today is maternal and child health care, which is an important program in primary health care. We will have two lectures. Today we will have the first MCH lecture. You will have first the importance of having children and mothers as important group in the community. We will have also, we will define antenatal care, objectives of antenatal care. We will talk about risk approach during the pregnancy and also screening or checking for some important health problem during pregnancy like anemia and pre-eclampsia. First of all, I want to clarify why in any community, especially in developing countries, mothers and children constitute a priority group. First, because they approximately constitute about 70% of the population, especially in developing countries. And they are the major consumers of health services. The majority of attendance to the healthcare centers or to the hospitals, majority of them are from mothers and children. They are also considered as vulnerable or special risk group, especially mothers during pregnancy, childbirth, and the exposure of young children to many health problems, especially infectious diseases or respiratory or diarrheal diseases. Also, it has been found that 50% of all deaths occur in the first 5 years of life. The maternal mortality ratio is very high, especially in developing countries, which may reach up to 440 per 100,000 live births, if compared to developed regions, which may reach up to 13 per 100,000 live births. Also, mortality rates like maternal mortality, infant mortality, under 5 mortality are all higher in developing countries. And in addition to all of this, much of the health problems, diseases, illnesses can be prevented in both mothers and children because majority of them have a non-risk factors. So antenatal care, as a definition, it is the care of women during a pregnancy. The aim of this antenatal care is to achieve at the end of the pregnancy a healthy mother and a healthy baby. But we have different objectives to reach this aim. These objectives of antenatal care is first to promote, protect, and maintain the health of mother during a pregnancy. And also, the central important point is to detect high-risk cases, mothers with risk factors that are expected to have complications during a pregnancy so that they can be detected early and management can be offered. Also, early detection and management of complications is an important objective of antenatal care, like pre-eclampsia, for example, anemia or other diabetes, gestational diabetes, or any other complication. Also, anxiety and stress can be relieved. That may be related or associated with delivery of the baby. Also, the objective, of course, is to decrease maternal and infant mortality and morbidity. Also, during antenatal care is a good appropriate opportunity to inform mother about child care, nutrition, personal hygiene, and environmental sanitation. Another thing is to discuss with the mother about family planning, because, as we said, antenatal care is an opportunity to meet with the mother, so we can discuss with her many topics related to her health during a pregnancy or between pregnancies. Also, an important thing is to attend to the under 5 accompanying the mother, because mothers, when attend antenatal care, they usually accompanied by their children. So we may also have opportunity to follow these children for vaccination, for growth monitoring, and other things. The health of the newborn baby is very much related to what happens in the uterus. So if the mother is healthy during the pregnancy, we expect to have a good, healthy baby at the end of the pregnancy. So this is very much related to the nutrition of the mother during the pregnancy, illnesses like infection or any diseases that may affect the mother. Also, drugs taken by the mother may affect very much the health and growth of the baby in the uterus, and also environmental or external factors like chemical substances that the mother should be exposed to during pregnancy. The first trimester, or the first 3 months of pregnancy, is very critical for both the mother and the baby, because at this time, especially for the fetus, different organs and body parts are being differentiated. So any interference with this process may lead to congenital malformation, such as drugs during pregnancy or any infections that may occur to the mother. For example, infection with rubella or German measles may lead to congenital rubella syndrome of the newborn baby. It has been found that congenital malformations of the newborn, amongst all these malformations, 10% has been found due to genetic factors and traceable in the family history. The other 10% is due to chromosomal aberrations, while the vast majority of these congenital malformations, 80% of them, is due to extraneous or external factors. And these factors are preventable. So even congenital malformation can be prevented because the majority of the causes or risk factors are preventable. So regarding the antenatal care visits, ideally for uncomplicated pregnancy, all mothers should be advised to come to the antenatal care visits, to the antenatal care center, monthly. During the first from start of a pregnancy or from the first visit until 28th week. So the first 7 months almost of pregnancy, the mother should visit the antenatal care clinic monthly. Then every 2 weeks from 28th to 36th weeks of a pregnancy. And then after the 36th week, the mother should attend antenatal care every week. But even though this is an ideal antenatal care visits, it has been found that these too many visits may not be followed by many mothers and may not be needed for those with complicated, although they are still considered as at low risk. But it has been found that a minimum of at least 4 examinations should be insisted upon. And there should be at least 2 visits to be made in the last month. In developing countries, 4 main components should be found in any antenatal care program. The first is risk screening to detect mothers who have high risk or expected to have poor outcome of pregnancy. Also, looking for and detection of associated illnesses as early as possible to treat them and manage them appropriately. The other thing is maternal nutrition and health. Also, health education is an important component, especially education and informing mother about safe delivery and the early recognition of complications by informing her about the signs and symptoms or danger signs and symptoms of complications during pregnancy. The first visit or the booking visit, which should be as early as possible, or even sometimes we advise to come even before pregnancy. The mother attend the clinic before she gets pregnant to have to be followed appropriately and to detect or assess her condition before pregnancy. So in this first visit, the most important thing to be assessed on is mother's general health and past pregnancies. So regarding general health, there are important things in the history that if found, the mother should be referred for a skilled opinion, like the mother has TB, heart disease, diabetes, or any sexually transmitted disease like gonorrhea, syphilis, orthopedic condition, or any previous gynecologic operation, or if she has scar, abdominal scar of previous surgery. Regarding past pregnancy, if the mother has any of the following in her past pregnancies, like abortion or ectopic pregnancy, bleeding, toxemia or pre-eclampsia, history of difficult labor, previous cesarean section, or postpartum hemorrhage, history of blood transfusion, history of stillbirth, neonatal death, or preterm delivery or low birth weight baby. So these also should be referred for a skilled opinion. This is regarding the history and general condition of the history of general condition and past pregnancy of the mother. Regarding first the present pregnancy, when the mother comes in her first visit to antenatal care, of course, the important information that should be taken regarding history, the age of the mother is very important because adolescent or older age group may be at risk of developing many complications during pregnancy. The first day of LMP, so that expected date of delivery can be calculated. Also, family history and health of other children, because we should always be aware about onset of pregnancy and spacing between children, which should be at least or less than 2 years between pregnancies. Also, if the mother has any symptom like headache, vomiting, swelling of ankles, bleeding, or discharge, should be assessed carefully. Examination, of course, for general condition like for anemia, edema, the weight of the mother also should be detected. All these parameters considered as screening for mothers during antenatal care to predict any complication or health problem that may occur during a pregnancy. So any gain of weight over 2 kg in a month is significant, especially if associated with hypertension, because this may be indicative of a preeclampsia during a pregnancy. Also, height of the mothers, usually mothers below 150 centimeters may have difficult labor. And of course, body mass index should be estimated early in a pregnancy or pre-pregnancy. And of course, the cutoff point for BMI is the recommended BMI 18.5 to 24.9 kg per square meters. Also, of course, examination of abdomen for fundal height, position of the baby, blood pressure, also testing urine for albumin and sugar, and blood tests for, like, for example, blood group, hemoglobin, or for other sexually transmitted diseases like syphilis or HIV. Risk approach. As we said, the central purpose of antenatal care is to identify high-risk cases as early as possible from a large group of antenatal mothers and arrange for them skilled care while continuing to provide appropriate care for all mothers. By this we mean we want to detect mothers who have risk factors for developing complications or different health problems during a pregnancy, and to provide management for them. So these risk factors, starting from age below 17 or over 35, the height if under 150 centimeters, weight less than 40 kg, all these are cutoff points to detect those who are at risk. Also, mid-arm circumference less than 23 centimeter or poor weight gain. Blood pressure over 140 over 90 millimeter mercury. Of course, this will be discussed later by screening for hypertension or preeclampsia. Also, swelling of feet and ankles, vaginal bleeding, anemia, abnormal presentations, twins, disproportion, hydramnios, abdominal pain, elderly primey over 30 or younger primey 16 and under, multiparous woman when she comes in her 5th pregnancy and above, and a previous history of pregnancy wastage or neonatal death. Of course, at antenatal care centers, health centers, there is certain scoring for these risk factors so that mothers are classified into high risk, moderate risk, and low risk. And it has been found that mothers at high risk of an obstetric history may have 26% rate to develop complicated labor, while mothers without any of these risk factors may have a rate of 11% to develop complicated labor. So still, mothers without any risk factor should not be considered with no risk and should be continued to follow them during antenatal care. There are also important danger signals that when found or detected, the mother should be referred urgently to hospital. These danger signals are vaginal bleeding, edema of vaginal bleeding, it may indicate abortion or antepartum hemorrhage, edema of sudden onset, persistent severe headache, which may be indicative of pre-eclamptic toxemia, reduced fetal movement, which may be a sign of fetal death. Also, vaginal discharge, if it is abnormal, watery, blood-stained, foul-smelling, or if the mother has severe abdominal pain with pallor, weakness, or fainting, which may be indicative of ectopic pregnancy, high fever accompanied with breathing difficulty or stiff neck or extreme lethargy. So for all these conditions or danger signals, the mother should be referred urgently to hospital. Regarding health education, the main topics that should be considered in health education session with the mother is about her diet, how to take care of her baby, child care, the importance and length of breastfeeding, also child spacing and family planning, to discuss with her the different methods of family planning, and also inform her about dangers of unsafe abortion. And it is preferable if including fathers or any older person in the family in this health education session. The other important thing that should be done during antenatal care is immunization against tetanus. In our country, mothers are immunized or vaccinated with tetanus toxoid vaccine. Of course, the first dose is taken usually in the second trimester or the fourth month of a pregnancy. This first dose does not confer any immunity to the mother or protect the baby from neonatal tetanus. The second dose is given 4 weeks after the first dose. This, of course, will protect the baby by about 90% from neonatal tetanus, and also will give immunity to the mother for 1 to 3 years and protect from also maternal tetanus. The third dose is given 6 months after the second dose, which is after delivery of the baby. And this gives immunity to the mother for 5 years and protects and gives also 100% protection for the baby at birth. The fourth dose is given 1 year after third dose, which gives immunity for 10 years for the mother and also protection for the baby. And the last fifth dose is given also 1 year after the fourth dose and give protection for the baby and also immunity for the mother for 20 years. Checking for anemia or screening for anemia during pregnancy should be done at every visit. So first, assessment of anemia among pregnant women should be started with an important questions. Anemia, we ask the mother if she tires easily or if she has shortness of breath during routine household work, routine work at her house. And also measure hemoglobin. This should be done, measuring hemoglobin in the first visit, but on subsequent visits, also to assess anemia. We should look also, of course, for conjunctival pallor or palmar pallor, if it is severe or if there is only some pallor, and also to count the breaths per 1 minute. So after assessing the condition of pregnant women regarding anemia, we are going to classify according to these signs. So mothers will be classified to have severe anemia if the hemoglobin is less than 7 grams per deciliter, and or if the mother has severe palmar and conjunctival pallor, or if the mother has any pallor with any of the following: breaths more than 30 per minute, if she tires easily, or if she has shortness of breath at rest. So any of these may be considered for the mother to have severe anemia. Of course, at primary health care, not only physician or doctor can assess for anemia. Any of the paramedics can do this job, so that's why only simple signs are needed for assessment and can be detected easily. So for those mothers with severe anemia, the plan of the birth should be revised so that to advise mother to deliver at hospital where there is facilities for blood transfusion, and also they should be given double the dose of iron. Usually WHO recommends iron tab from 30 to 60 milligram, and regarding folic acid 0.4 milligram. So regarding iron, the mother should be given twice the dose daily, and 2 tabs daily for 3 months. This is, of course, the measures that should be taken at antenatal care, and follow the mother 2 weeks later to assess her compliance with the treatment, but they should be also referred urgently to hospital. Mothers with moderate anemia are those who have hemoglobin from 7 to 11 grams per deciliter, or if they have palmar or conjunctival pallor. So we also give double dose of iron for 3 months and reassess the mother after in the next antenatal care visits, or after 4 to 6 weeks. So if the mother still have anemia, refer to the hospital because they may need blood transfusion. Mothers with no anemia, if they have hemoglobin more than 11 grams per deciliter, or if they have no pallor at all. So we only give a prophylactic iron 1 tab once daily for 3 months, and of course assess her condition in the next antenatal care visits. Checking or screening for pre-eclampsia. All pregnant women should be screened for hypertension or pre-eclampsia at every visit. So the important questions or checking for mothers for pre-eclampsia is by first taking the blood pressure, and the measurement of blood pressure should be done in sitting position. If the diastolic more or equal to 90 millimeter mercury, the mother is asked to have a rest for 1 hour and to repeat the measurement. If it's still more than 90, equal or more than 90, ask the woman if she has any of the following signs: severe headache, blurred vision, epigastric pain, and also check protein in urine. So, the mother will be classified to have severe preeclampsia if diastolic blood pressure is equal or more than 110 millimeter mercury with 3+ proteinuria, or diastolic blood pressure equal or more than 90 millimeter mercury on 2 readings with 2 proteinuria and any of the following signs: severe headache, blurred vision, epigastric pain. So, mother with severe preeclampsia should be given magnesium sulfate, appropriate hypertensive, and also revised birth plan to advise delivering at hospital. And the most important, the mother should be referred urgently to the hospital. The mother may have or classified to have only preeclampsia if diastolic blood pressure is 90 to 110 on 2 readings with 2+ proteinuria. Here also, revise the birth plan and give the mother immediate or initial drugs at the clinic, but should be also referred to the hospital. If diastolic blood pressure is equal or more than 90 on 2 readings, the mother is classified to have only hypertension. So here we should advise mother to reduce workload, to have more periods of rest, and advise her on danger sign of severe headache, blurred vision, so that any of these signs, if occurs, she should come immediately to the clinic and reassess at the next antenatal visit or in 1 week if the mother is at her last month of pregnancy. If hypertension persists after 1 week or at next visit, the mother should be referred to the hospital. If none of the above, that's regarding the blood pressure, proteinuria, or any of the above signs, the mother has no hypertension and no other treatment required. Lastly, I want just to enumerate some of the maternal and fetal complications of severe preeclampsia. The main important complication is abruptio placenta, at which the mother presenting with antepartum hemorrhage, coagulopathy, renal and liver failure, long-term cardiovascular problems, preterm delivery, low birth weight, perinatal death, and hypoxia. That's all for our lecture for today, and we will continue with MCH in the next lecture. Thank you.